Hello and welcome to your Legent pre-surgical educational video. Preparing for surgery can feel like there is a lot of information, but we're here to guide you through the process to help ensure a smooth experience. In this video, we'll discuss key information about your surgery and what you can do to prepare. We'll also include important post-operative surgical care for your best outcome. We would like to point out that on our website, where you likely found this video, we have a multitude of resources available to guide and answer questions that you may have regarding pre- and post-surgical care. First, we will discuss some things that you can start doing now to prepare for your upcoming surgery. Before surgery, it is important to follow specific guidelines to reduce the risk of complications and promote a faster recovery. We would encourage you to optimize your diet and hydration levels now, ensuring that you are eating plenty of fruits, vegetables, and lean meats or other protein sources. It is important to initially optimize your body for healing postoperatively. Start now by drinking at least 8 cups of water daily. Continue to stay as active as possible before surgery. Daily light stretching will also help optimize your body for mobilization limitations after surgery. Smoking and drinking alcohol can significantly affect your healing process. Smoking nicotine slows your circulation and reduces oxygen in your blood, which makes it harder for your body to heal after surgery. Other forms of nicotine do the same. This includes dipping, vaping, etc. Alcohol can interact with medications and anesthesia, making recovery more difficult. If you smoke, use other nicotine products, or drink, we recommend highly that you stop at least 2 weeks prior to your surgery for your improved recovery. If you regularly consume alcohol or are dependent on it, please contact your surgeon before stopping to create a safe plan tailored to your specific needs. Preparing your home for a safe area after surgery is also important. This may look like removing rugs that you could trip over, installing a shower, chair, or bar as necessary, and planning for pets to stay with a neighbor for the first week or two. Meal prepping or purchasing easily healthy options to eat after surgery is also recommended. Go ahead and make a list of all the medications, vitamins, and supplements that you are currently taking, and note which ones that you have stopped taking. You will need to bring this list both with you to your pre-surgical doctor's appointment and to the day of surgery. Before your surgery, we will need to review your medications with your healthcare team. Some medications and supplements, such as blood thinners and NSAIDs, can increase your risk of bleeding during surgery. Your doctor will give you specific instructions on which medications to stop taking and when. Ask them about stopping and continuing your anticoagulant or blood thinner medication, as well as your non-steroidal anti-inflammatory drugs or NSAIDs. These include ibuprofen and Advil. The stop and restart times of blood thinners and NSAIDs are critical in your healing process for certain surgeries, so please consult with your surgeon before stopping and before restarting these medications. For guidance on which vitamins and supplements to continue or stop taking prior to surgery, please review our handout on our website with this important information and ask your surgeon if you have any questions. If you are on a GLP-1 medication, these would include semaglutide, Ozempic, tirzepatide, and Mounjaro. Please ask your surgeon and anesthesiologist for specific instructions regarding preoperative medication and or diet modifications necessary to your individual medication situation. Each diabetic patient's condition is unique. You know your body better than anyone else, and it is our goal to support the management of your diabetic health during your surgery. This begins with making sure that your blood sugar levels are well controlled prior to the morning of your procedure. Please refer to our website's reference sheet for pre-surgery diabetic management for the most up-to-date diabetic education specific to your needs, and consult with your surgeon for a plan tailored to your specific blood sugar control needs. When packing for your surgery, you should include the following: your ID, insurance card, form of copay method if applicable, the list of your medications and supplements, loose clothing, toiletries, glasses, hearing aids, and or dentures with their cases if needed, closed-toed, easy to slip on shoes, a book or tablet for entertainment, and a loved one to drive you home. Avoid bringing valuables such as jewelry, large amounts of cash, or electronics. We will encourage you to have your loved ones hold on to these items while you're in surgery, as the hospital will not be responsible for any lost items. When choosing your ride home, please ensure that you are picking a responsible adult that will be able to help you should you need it. For safety reasons, we cannot allow you to leave in a rideshare or taxi service by yourself after surgery if you have had more than just local anesthesia. These services include taxi, Uber, Lyft, and even medical Lyft. If you are wanting to use a ride share or taxi service and are unsure if you are having more than local anesthesia, please call your surgeon's office or your Legent Health facility and ask, and we will be more than happy to guide you on this matter. The day before surgery, please make sure to drink plenty of water. Do not drink any alcohol or use any nicotine products or other illicit drug products. Do not eat or drink after midnight. There are exceptions to this, such as if you are having a GI procedure or bariatric surgery. If this is the case, please follow the bowel prep and bariatric prep instructions provided by your surgeon in your pre-op appointment. Make sure that if you've been asked to use a CHG soap shower the evening prior, that you do so. If you've been instructed to shave, please use an electric razor to avoid any cuts in the skin, which may pose a risk to infection going into surgery. After you're showered, don't use any lotions, perfumes, topicals, serums, or anything like that. Next, we'll talk about infection prevention. A few days before your surgery, your surgeon may ask you to perform a pre-surgical wash using a special antimicrobial soap called CHG, chlorhexidine, or Hibiclens. This helps reduce the risk of infection. Be sure to follow these instructions carefully. It's usually done the night before and the morning of your surgery. Be sure not to apply any lotions, perfumes, topicals, serums, makeup, etc. after showering with the CHG or Hibiclens soap. Before and after your procedure, be sure to wash your hands thoroughly and often. Make sure your loved ones and caregivers do the same. And never touch your surgical site directly. Lastly, do not allow pets or animals to share a bed or chair with you at this time. Your surgical site needs to heal completely before you are exposed to pet germs, dander, and hair. Signs and symptoms of infection need to be reported to your surgeon immediately. These would include a fever greater than 101 Fahrenheit, redness, swelling, or pain around the surgical site, green or yellow drainage from your incision site, or a bad odor. To help with lung function and prevent pneumonia, deep breathing exercises and/or the use of an incentive spirometer are recommended. The incentive spirometer helps you take deep breaths to help clear your lungs. If you stay overnight or receive an incentive spirometer to go home with, please ensure that you are using it as directed to avoid respiratory complications and to speed your recovery. After surgery, it is important to watch for signs of blood clots. These can occur in your legs, lungs, or elsewhere in your body. Warning signs that you would want to look out for this would include swelling in one or both legs, red or discolored skin, pain or tenderness, specifically in your calves, shortness of breath, or chest pain. If you notice any of these symptoms, please call 911 or your surgeon immediately. Post-surgery care also includes the management of constipation. This can occur due to anesthesia and pain medication. To help prevent this, ensure that you are drinking plenty of fluids, eating fiber-rich foods, and following your doctor's advice on use of stool softeners and laxatives. Sometimes there are situations that require immediate medical attention. If you experience any of the following after your surgery, call 911 immediately. Severe chest pain, difficulty breathing, sudden weakness or numbness, loss of consciousness. These symptoms may indicate a medical emergency, and it is important to get help right away. Other symptoms that are necessary to call your surgeon's office if you are experiencing include increased swelling, redness, drainage from your surgery site, fever greater than 101 Fahrenheit, persistent pain not relieved by medications, persistent nausea not relieved by medications, green or yellow drainage from your surgical site, or a foul odor. Remember that you are not alone in this journey. Your healthcare team is here to support you every step of the way. If you have any questions or concerns, please do not hesitate to reach out to your surgeon or your Legent facility. Thank you for taking the time to watch this video, and we wish you the very best for your surgery and a speedy recovery. Thank you.